My name is Lybarger and I'm a graduate student at Seattle University. Today I'm going to be demonstrating how to do an oral health exam on a patient during a well-person exam. This is really important to do because periodontal disease affects many people in the United States. It is an infection of the tissues supporting the teeth. Periodontal disease triggers systemic inflammatory pathways and has been linked to negative effects on both the cardiovascular, renal, and endocrine systems. Furthermore, in pregnancy, periodontal disease has been linked to low birth weight, preterm birth, and preeclampsia. Examining the mouth also provides a great opportunity to not only screen for these disease processes, but as well as oral cancer. So, asking patients about their oral health status informs the patient that the mouth is not simply cared for by a dentist, and it creates the opportunity for the primary care provider to become aware of an issue that may impact systemic health. Today, I will be demonstrating how to incorporate this oral health screening into a well-person exam. First, you want to start by asking your patient one simple question. Hi, Claire.
Hi.
Are you having any issues in your mouth, such as bleeding gums, loose teeth, any holes in your teeth, any areas of sensitivity?
No.
Great. Have you been to a dentist in the last 6 months?
I haven't.
So, I would really encourage you to go to the dentist because it's important for your health. I can give you a referral today for a dentist.
Great.
Excellent. In addition to giving your patient a referral, you also want to look inside their mouth in case there are any red flags that should not be missed for today's visit. So, starting out with the exam, what I'm going to be assessing is just her face structure. And I'm looking at her skin, and I'm looking for any color or texture changes or any obvious abnormalities. I do not see any on her. Then I can feel her lymph nodes, just like you would do in your normal well-person exam. And I'm not feeling any inflamed lymph nodes on her either. While I'm looking at her from the outside, I'm also assessing her lips for the color, texture, and any other anomalies. It looks very healthy. Go ahead and open your mouth a little bit for me. So now I can go ahead and put on my gloves. And I can get out my pen light. So Claire, I'm just going to look on the inside of your mouth here. You're just going to feel my finger. And here I am. I'm able to assess looking on the inside of the cheek, the inside of the lips, and I can go all the way around. Sorry, you can feel my finger? And I'm looking for any sort of redness, oozing, or any sort of discomfort. Does any of that hurt in there?
Mm-hmm.
Excellent. Okay, and I'm looking underneath the tongue. Go ahead and lift up your tongue for me. And I'm looking at the floor of the mouth. I'm looking for any sort of discolorations. Go ahead and stick your tongue out for me. Also able to assess the cranial nerves when she sticks out her tongue. Go ahead and open your mouth nice and wide. Say ah.
Ah.
Great. I'm able to assess the hard and the soft palates. You can grab a gauze pad. I'm just going to go ahead and hold the tip of your tongue and move it to the side so I can look at the sides of it. And now I'm able to assess the sides of her mouth, both sides. And now you're just going to feel me squish your tongue. Can assess for any masses, and then I'm also going to just feel the floor of your mouth for any masses as well. All of that feels completely normal. The last thing that you want to do that is often not shown on oral health exams is to actually assess the teeth. So Claire, go ahead and open your mouth again. You're just going to feel me just kind of wiggling your teeth a little bit for anything that feels like it's loose. Did any of that hurt at all? Great. And then you can also see I'm looking at the surfaces of her teeth to see if there is any area of any sign of a cavity, which would be a darkened area with irregular borders where the enamel comes together. And the last thing, can you make it so that I can really see your gums nice and well? I'm looking just at the line of her gums along her teeth for any sorts of sign of swelling, bleeding, oozing of anything, and all of that looks normal. So I say, Claire, you don't have any real obvious signs of periodontal disease. However, I do strongly encourage you to see a dentist for routine screening.
Okay.
Thank you.